In today's lecture, we will talk about experimental epidemiology, and the topics for today's including the comparison between experimental and observational epidemiological study designs, and the different types of experimental epidemiology studies. We will mainly focus on the methodology issue for the experimental epic study, and finally, we will talk about the ethical issues in the studies. First, let's see the difference between the experimental and observational studies. And in the analytical epidemiological studies, in the observational studies, we usually compare exposed to unexposed groups, but the epidemiologists usually observe exposure rather than examine. And in experimental studies, the researchers actually determines who is exposed. So most epidemiological studies are observational, but interventional studies have a special status. And epidemiology is really an experimental science. Most of the time, epidemiologists will just go out and measure the rate of occurrence of a disease or other health outcomes. Or we'll compare patterns of exposure and disease to identify the particular exposure for risk factors associated with the disease or outcome. This is a particular observational job. The researcher does not intervene in any way. He or she leaves nature to take this course and records what happens or what happened in the past. And in experimental study, which is also called intervention studies, these are employed to attempt to change something to see what effect this has on disease occurrence or test the efficacy of preventive or therapeutic measures. These experimental epidemiological studies allow us to experiment in other sciences because the investigators control who is exposed and who is not, who is allocated to a new treatment regimen and who receives the old treatment, or who is enrolled in a stop smoking campaign and who is not. Clearly, it would be acceptable to conduct such an experiment only if we thought that the effect on the test would improve health, and not be ethical to expose people to something thought to be harmful. Here we can see that in the study design for different types of the epidemiological studies, the interventional trial are the experimental studies, while other study types that we have talked about in previous lectures, such as cohort study, the case control study, and cross-sectional studies, all of them are observational. In this slide, we can see the difference between the observational cohort study and the randomized clinical trials. So the observational cohort study and the experimental studies, both of them will follow up the participants. While the actual difference between these two are the allocation of the exposure, and you see here from the left side of the figure that the population was allocated into group A and group B randomly. While in the observational study, the population was allocated according to their exposure, that is other than random. And this is the main difference between observational cohort study and randomized clinical trials. So here's a detailed comparison. You see here, for the cohort study and experimental study, both of them have the control group. Both of them will follow up until the outcome occurs, and both of them are prospective studies. However, the groups in the cohort study are not randomly allocated, while in the experimental studies, the groups are randomly allocated to the experimental group and the control group. In the cohort study, there will not be any interventions, while in the experimental study, we need interventions. And in cohort study, we are not under the direct control of the investigators, while in experimental studies, the study was under the direct control of the investigators. The investigators will determine whether the participants will be intervened or not. Here in the pyramid, we can show that the evidence strengths of the different types of studies. So the higher in the pyramid, it shows that the evidence is the strongest. So we can see that in the top level evidence, including the systematic reviews and the meta-analysis, and the second strongest evidence is randomized clinical trials. And therefore, thereafter, we have the cohort study, we have the case control study, we have the cross-sectional study, etc. When we talk about clinical trials, we should take into the history to see what is the first clinical trial that was performed in the history. Here we introduce James Lind and his experiment of therapies for scurvy. And we can see that in the area of these navies, that the navy of the Britain has traveled around the world, and they are suffer from the sailors in the navies are suffer from the scurvy. And therefore, James Lind, as a clinician in the navy, he have tried 6 different types of medicines to trying to cure the scurvy, including citron and oranges. And within this group, he finally found that the scurvy was cured by eating citron and oranges for those soldiers. And if we consider as the randomized clinical trial, the actual first randomized clinical trial was conducted by Sir Austin Branford here. And if you know the very famous study that was performed by Dunn and Hill in the history of smoking and lung cancer, you're also familiar with this name, because this year is also performed the first randomized clinical trial. And his trial was published again in the British Medical Journal about streptomycin and tuberculosis. So in this slide, we will talk about the features of different type of experimental study. First, the experimental study is a prospective study that we need to follow up the patients to see what is the clinical outcome of the patients. And the second is randomization. The patients are randomized allocated to the experimental or control group, and this randomization also makes sure that the comparable between these two groups. So therefore, we have a comparable control group for the study, and then the control is similar to the experimental group. The difference in the outcome is therefore only because of the intervention they were performed. And the fourth feature is that we have the intervention for the study participants. The experimental study covers 3 major types: clinical trials, field trials, and community intervention trials. The principle of sound design and conduct are common to all. The epidemiological experiments are most frequently conducted in the patients, with the aim of evaluating which treatment for disease is better. Such studies are known as the clinical trials. Here we take an example of the researchers in the United States and Canada have designed the clinical trial to address the following question: whether intensive treatment with the goal of maintaining blood glucose concentrations close to the normal range could decrease the frequency of retinopathy. And in this trial, in the primary prevention cohort, 726 patients with insulin-dependent diabetes and no retinopathy at the baseline were randomly assigned to the intensive therapy administered either with external insulin pump or 3 or more daily insulin injections guided by frequent glucose monitoring, or it is to the conventional therapy with 1 or 2 daily insulin injections. These patients were followed for a mean of 6.5 years, and the appearance of retinopathy and other complications were assessed regularly. So during this follow-up, the retinopathy developed in 23 patients in the intensive therapy group and 91 patients in the conventional therapy group. The incidence rate of retinopathy for the conventional therapy group was calculated to be 4.7 per 100 patient years of follow-up, and 1.2 per 100 patient years of follow-up for the intensive therapy group. The intensive therapy reduced the adjusted mean risk for the development of retinopathy by 76%, and as compared to this conventional therapy. And we can see that the reduction in the risk increased with the time. It is concluded from this clinical trial that the intensive therapy effectively delays the onset of diabetic retinopathy in patients with insulin-dependent diabetes. The second type is a field trial. The epidemiologists also conduct a field trial or preventive trial, which differ from the clinical trials, mainly in that they involve people who are disease-free, but thought to be at risk of developing disease instead of the patients. And their common goal is to study the primary prevention of the disease. Ideally, these diseases should be conducted in the same way as the randomized clinical trials. And the last former human experimental ever conducted is the SOX vaccine trial in 1954 in the USA. It is a prominent example of a field trial. In this study, over 400,000 school children were assigned to receive either the vaccine or a placebo, that to evaluate the efficacy of a new vaccine to prevent polio. The trial clearly demonstrates both the efficacy and the safety of the vaccine, which was then given to millions of children throughout the world. This has led to a major drop in the incidence of polio, not only in the industrialized countries, but also in many developing countries, which has been declared polio-free in the WHO region of the America in 1994, and in the West Pacific region in 2000, and in the European region in 2002. Another type of experiment is a community intervention, in which the intervention is implemented at the community level instead of the individual level, and is generally conducted when it could be impossible to offer or evaluate the intervention at the individual level. For example, the community fluoridation trial in the 1940s and 1950s that evaluated the effect of fluoride in community water supply were community intervention trials. Here, when the investigators wanted to study the effects of adding fluoride to the water supply on dental health, it is clearly impossible to add fluoride to some people's water and not to others. So the whole towns were allocated to receive fluoride in their water or not. The controlled trial of water fluoridation, which gave the most striking result, was carried out in the towns of Newburgh and Kingston in the New York state. After 10 years of fluoridation, the delicacy, missing, or field teeth score for the Newburgh children aged 6 to 16 was 50% lower than that for the children in the unfluoridated town of Kingston. And the assumption underlying this result was that, apart from the water, there was no other major differences between the towns that could explain the effect, so which means there was no other confoundings. Here we can see a diagram of a community trial, in which we can see that we have a population A and a population B, and we want to observe the occurrence of disease for the specific time. And we then randomly assigned population A and population B into the intervention group of the control group, and therefore we measure the outcome of this disease. In this slide, we show the comparison between field trial, clinical trial, and community trials. So it's clear that the clinical trials are placed in the hospital, while the field trial and the community trials are placed in the communities. And the participants for the clinical trials are mainly patients, while participants for the field trial and the community trial are healthy people. And the unit for the allocation for the groups for the clinical trial and the field trial are individuals, while in the community trial, we allocated groups as a unit for different type of interventions. And for the types of interventions, in clinical trial, the intervention is mainly for the therapeutic use, while in the community and the field trial, the intervention are for the preventive use.